shoulders pushed down and then back around and pops them back in. It's like this could be. Yeah, it's kind of fun to do. You've never done it, really easy. Finger dislocations, you see these all the time. With a key rate reduction, especially fingers, is you have to make it worse before it gets better. So you're going to bend it further, pull it out, and go back up and around. You don't just shove it back across, because if you push it back across, what happens is you see bone on bone, if you shove it across, you snap the end right off. You've got to pull it up, exaggerate it, and pull it back and put it, you set it on top. Super fast little procedure.
You gotta sound scared.
Oh, no. No, see, this is what happens when you do it wrong and break the whole chunk off, so don't do that. Elbow dislocations and knee dislocations you don't want to miss. Elbow dislocations with neurovascular compromise or knee dislocations are true emergencies. They need to come off the mountain now. This is not one that you get to have packed off the mountain. They must be flowing off because they are truly devastating injuries sometimes. So a true elbow dislocation with neurovascular compromise or any knee dislocation, not kneecap, knee dislocation, they have to come off. So again, just elbow dislocations, they look terrible, they hurt a lot, show the idea, but basically splint them, give them some pain medicine if you can. Let's see, and then elbows, shoulders, where the screws. I know my time's up now, isn't it? There's different ways of putting the shoulders back in, which I'm not going to show you until I get to, you can look at fast, but almost there. This is the one you want to use to put shoulders back in. If you can get them on a boulder, a square boulder, where they can actually lay down prone, so face down, bad arm hanging off the rock. Let them lay there for 10 minutes. Just tell them to relax, especially everything in the shoulder. A little yoga exercise. Relax, relax, relax. And all you have to do is have somebody put maybe 5 pounds or maybe 10 pounds at most of just gentle, persistent traction. Somebody push the very tip of their shoulder blade towards your spine, the thing pops right in just like that. 99% of the time it's going to work. Slick as could be. I don't even give these patients medicines in the hospital. I'm not ruthless. I say, listen, I can have it back in 5 minutes, or do you want to have an IV, sedation, can't go home for an hour, I'll just put it back in. That's the majority of them say, just put it back in. It's really effective. This is what you can do in your kitchen counter. And this is what I do in the ambulance, and that's why the docs get me in the ER too, is because I put the shoulders back in, the patient can stay home.
What do you do if you don't have a table or a wall?
You have to get them up off the ground. Now you can actually create some way, but they have to relax. So if they have to hold themselves up, they're using their muscles in their back. So you just have to be creative. You want to pile 8 packs up on top of each other and have them lay across the packs, whatever it takes to do that, across the log. You just need to get out in that prone position. If you don't have that, you want to try and do it laying down. You can do the similar technique of just having somebody pulling up. You have to have somebody pushing your chest down a little bit. You pull up and then have somebody reach behind them. And same thing, roll that shoulder blade towards the spine. Then it pops back. It's just a little harder to do though. And it's harder on the patient because they can't relax as good. If you're more pushing and pulling, they're not relaxing. That's your patella dislocation. It's not a big deal. They look very distorted. But trust me, that's not distorted compared to a true dislocation. That is a knee dislocation. Now you see the difference. Okay, kneecaps popped over, but once you put it back in, it looks perfectly fine. That is a knee dislocation. I don't think you're going to mistake the two. Check the neurovascular status distally. So again, knee dislocations, true emergencies actually disrupt nerves and blood vessels, which is why they go to the OR, they do angiograms. They get a lot of workout done. Ankles, the same kind of thing we talked about. Don't forget the splinting, right? You can see all the pictures I have. These are not all the same ankles. It's just over and over and over we see them. Splints, remember, ugly, fat, and fluffy. There's no rules on that one. Think about compartment syndromes when you put people in extremity splints with their leg especially. You get the form, but more common in the leg. A lot of times when they have a broken leg, they swell up super bad, or long distance runners who aren't used to it, they hurt themselves. They swell up, they get compartment syndrome, and then we get to lay them open. What happens in the compartment, the pressure builds up, these compartments in the muscles of the leg don't expand. They stay the same size, so the pressure builds up, cuts off your circulation, and this is what we get to do in the ER. So we'll lay you wide open, and we don't put it back together until your pressures are down. We're going to skip some of these skin things. That's just shingles, that's a nuisance, it's Honexline purpura, that you will die from. That's your flesh-eating bacteria, that's necrotizing fasciitis. And you're thinking, well, wait a minute, that one looked kind of bad. No, see, this is the hard thing with skin stuff. That is not good. She lost 2/3 of her entire chest wall, spent 2 months in the burning of the UU. So necrotizing fasciitis, terrible thing. But yeah, go practice some integument diagnoses. Minor flesh wounds, these are some of the disgusting things we see in the ER. We don't talk about that, but these are things classic. You can do that easily on Timpanogos. Simple little slip and fall, rip things open. It doesn't take much. It's a minor flesh wound. That does not need to come off the hill by anybody's assistance except the patient's own. And usually they don't hurt that much as long as you wrap them up, moisten the tissue, and get them out. You know, you can look at that and say, well, that's kind of painful. But again, it's not an emergency. You can package them up and send them off the hill as well. It just depends on how much pain you're in with that. That's just your arm, so they'll be fine. That one, they're not going to walk off the hill. Kind of angle, so yeah, you might have to fly that one depending on their vascular status down there. Big thing for me on these things are wound care. Be good about wound care. Don't kick the lawnmower, by the way. Yeah, so get the debris out, moisten the tissue, irrigate it really well. How do you irrigate it on the hill? One of the best things is your water bottle. Just puncture a little hole, squeeze it, you got a nice steady stream of water flowing out. Get your water bladder, you get your water pumps. All kinds of ways you can irrigate wounds. Irrigation, 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 very important. We have pressurized irrigation, or salad jet, these kinds of things. I like them, but it's such a small volume. Quantity is really important. And tap water, basically stuff you even take up your drink or you filter, is perfectly fine for irrigating wounds. You don't need fancy, sterilized, normal saline. It's a waste of your money. The best thing they found is tap water, even in the ER. They found that the infection rate is lower with tap water than with sterile saline irrigation. That's a fascinating study, and it wasn't just one of them. Wound closures, kind of fun. Most of them just leave them alone, tell them to get down and get it taken care of. There's a bunch of things up here if you want to see. Staples, the sutures, and steri strips, and fun things. I can show you how they all work later if you want. I'll stick around to the end. Dermabond is a great thing, but I would not suggest you use it in the field unless it's on the face and super clean, or a knife cut is super clean. That's your skin glue. Super glue, yes, it does work. You get it in the wound, though, it'll prevent it from healing. So be very good about how you do that. Hair ties, they work really well. Just tie your own hair up in the scalp, works really well. Molds nicely. A couple of drops of super glue on the hair knots and they stay forever. Your hair falls out or grows out. Suturing, I just don't suggest it. The staples, again, as I talked about, you come up and see something. Some of them are so small, like these things. These are your little backpacking versions. These patients come in, oh, it's staple time for us. Yeah, because I don't suture all those things. These are self-inflicted. Fish hooks, and I throw 4 bodies in there, but obviously the biggest thing is don't take them out of the face because you don't know what's underneath that one, which means they get them in their eyeball. Don't pull them out. But fish hooks are super easy to take out. If you're not a fisher person, just remember there's a barb on most hooks. Now, if you're a fly fisherman, a lot of people don't use the barbs because you can take them off really easy. But most hooks have barbs, which is why they don't slide out so easy. All you have to do is take an 18-gauge needle, which should be part of your kit. You slide that 18-gauge needle right down along the fish hook until it meets the barb, and you get a little tug and the whole thing slides her out. It's as slick as that. Well, some people say, well, just put it all the way through. Good, why don't you try that on your finger and see what it feels like. But it does work. You slide it through until the barb comes out, you snip off the barb, and you back it out. But remember, some fish hooks not only have that barb, they've got 2 barbs up here as well. And so I like to use an 18-gauge needle, slide it down very carefully, doesn't cause that much pain. Hook the barb, slide it out, so the barb goes inside the needle. Yeah, and you got a slick way of getting them out. Penetrating foreign bodies, and it's just common sense. Some things you just don't pull out. I like this guy who was on the lawnmower, or he was trimming the lawn, and a wire popped up. And I thought, I'll leave him there to see what happens. Well, that's where it went, right next to his C-spine. So penetrated clear back to his neck. So they pulled it out in the OR anyway. Now this one I was waiting for it because I want you to understand this one. This is a huge issue in the backcountry. You should put a sign up. Did you trim your toenails today? This causes so many people to lose their toenails. They want to have their manicured nails, but this is what causes problems in the backcountry. This is what shuts people down way in the backcountry, in the wilderness settings. Even the guys have long toenails sometimes, and they lose their toenails, and it really incapacitates them. Headaches, the most common reason people get headaches in the wilderness, including on Timpanogos, is because of dehydration. You all must be drinking fluids. How many of you ever had a headache when you get to the base camp? I have. Plenty of times. And it's my fault because I don't like to drink that much water on the way up. I just go. Because Glenn taught me not to stop. It's just, man, man's an animal. So I go and go and go, and sure enough, I pay the price. I get these headaches, and I think, is the altitude? No, it's your dehydrated. So push the fluids. Poor sleeping is a huge issue with wilderness medicine, especially high altitude, which is a whole separate different lecture, which is fun to talk about. But if you stay up on your fluids, you prevent a lot of the high altitude problems with headaches. Also, it helps with high altitude flatulence, so you don't know about that. You fart a lot in the mountains, and it's not because of what you eat, it's because of the altitude illness syndrome that goes on. So people produce significant gas problems, but if you drink lots of fluids, it actually helps a lot with that. Diarrhea, biggest thing for me on this one, don't rely on Imodium. Imodium is an evil medicine. Well, that's actually great for the ER, it's good for business. But it plugs people up. You have diarrhea for a reason, it's to get the stuff out. If you think it's just viral, my whole family got the same illness last week, and it's just a viral illness, you can take a dose or two and you're done. No more than that, ever. Otherwise, you have the potential of putting yourself in the ICU. Pepto, that's okay, 1 or 2 times a day, not a bottle a day. Although it shuts you down, okay? You put that little baby back there, all right? You don't walk so good. You need to, one, prevent them. I'm telling you, if you've never heard of anti-monkey butt and those kinds of things, this is good stuff. You want to prevent hemorrhoids. But you've got to empathize with people who end up with these things. This is the most common, not this thing, but hemorrhoids, are the most common ailment of the entire world. The most common medical problem. Isn't that a fascinating fact? Yeah, so hemorrhoids affect millions upon millions of people, but this will shut you down. If you've never had a bad hemorrhoid, I'm telling you, this is not fun because you can't walk straight. And it makes you sick, you can throw up. So sometimes this is not small. You ought to see some of them. And if they get huge, often we'll actually open them up and drain the big old blood clot out, and then they can actually start moving a little better. But that's probably not something you want to do on the hill, I'm guessing. Try and avoid constipation. Irrigate things out if you can. Flush things out. But the thrombus or clotted hemorrhoids, honestly, the treatment is open them up and drain them. That's wilderness, not turf, though, okay? So we don't expect you to do that necessarily. That's good enough. All right, now you guys all kinds of cool things.
Witch hazel.
Witch hazel is very good, no question about it. Preparation H is worthless garbage. Take it off the market. You want to go buy some good stuff. Get your used to be called candy salt. Tux medicated hemorrhoid ointment. That's what I tell all my patients. Yeah, like you needed to know that one. But all right, the rest of it just talks about all kinds of cool tools, the things you should have in your kit. But we're another 50 slides away. But I didn't intend to get that far into it. So I just want to give you the tip of the iceberg of what's out there with wilderness medicine. These are just some things I just threw together this morning when I got up and I said, let's have a little fun. But improvising, you must do it. Go back to when you were a kid, when you learned to experiment. Not take what was given to you all the time. Experiment, learn what's in your own kits all the time. Don't change your kits every time you go out on the hill. You should have pretty much a set routine of what you're taking with you. I know what's in my kit. I know what I can do with it. I think, what do I do with this little device right here? What can I do with my paracord? And again, think about it. Tear it down. Find out what's in the inner workings of paracord, which makes it so beautiful. So improvising, I love to do it. If you have any questions, let me know. And I think some lifelight's coming, right?
He's here.
Okay. I'm sorry I took so long.
Okay.
All right. Analyze it. Thank you.
Really appreciate Doug being here. It's always interesting. We ought to keep him around a couple more hours if we could. Maybe next year we'll try to plan for that. Or maybe at the outdoor training. I don't know if he's coming to that, but if he does, maybe he can give us a little bit more words of wisdom. I really like his attitude, the way he creates things. I used to take radios apart to learn how to make them and all sorts of things. So that's what we need to do. Anyway, we're gonna start up here with Lifeline shortly. It's going to be maybe 5 minutes, a couple minutes to get lined up, and then we'll get going here. So talk for a minute, and we'll move on.
Hey, I got to get going, but see you on the mountain. Thanks, you guys. Appreciate it.
Hey, thank you. See you.
Hey, Doc. Doc, I'll call you.
Absolutely. Thank you.
Hey, Doc.